Here we will be demonstrating a deep wound closure. To perform a deep wound closure, here we will first open up the suture pad from the bottom. For learning and demonstration purposes, we will peel up the 4 different layers apart so that you can differentiate between the different layers. As mentioned, for learning purposes, we will peel up the 4 different layers apart so that you can differentiate between the different layers. We will cut the layers open using a pair of scissors. You can see all the different layers and we are just opening them up. So you have a tissue of muscles, a white layer of fascia, a yellow layer of subcutaneous fat, and a pink layer of skin. These are the layers that you will be suturing while closing a deep wound. We will repeat the same thing on the opposite side. You can see the 4 layers: red muscle, white fascia, yellow subcutaneous, and pink skin. So any complex wound, you will have this kind of layer composition. We will start with our deeper muscle tissues first. The muscle layer will have to be sutured first. These sutures normally go in the direction of the muscles and the wound or the cut. So first thing is you approximate the muscle tissues. With muscles, you always take interrupted sutures and cut the thread as small as possible so that they don't interfere with the next layer. Normally, we use an absorbable suture for suturing deeper tissues. We will continue taking these interrupted sutures along the length of the muscle. You can always ask an assistant to retract the tissues if you're not able to see the layers properly. We keep suturing through the entire length of the muscle tissue. Roughly, the distance between the interrupted sutures is 0.5 to 1 centimeters. You can see the entire muscle plane being sutured. You can compare the difference with this side of the wound where the muscle layer has been opened up and here it is sutured together and closed. Once the muscle tissue is done, we will start suturing the fascia, which is a white colored layer. While suturing fascia, you need to take a good bite of the tissue. Some prefer to close the fascia with interrupted sutures and some prefer continuous sutures. Here we will be taking continuous sutures. Suturing fascia, you always need to take a good bite of the tissue because suturing the fascia properly gives good strength to your wound closure. You can see the layer of fascia that is getting approximated. Any excess thread that comes in the middle should be removed. With fascia, we always try and see that we go a bit beyond the edge while suturing just to give added security to the wound closure. In the end, you can just tie this thread to the previous loop. You can see the layer of fascia that is getting approximated. Now for this knot, what we normally do is we bury the knot. Now to bury the knot, we will just go in deep and come out of the subcutaneous tissue so that the knot gets buried inside. You can see there is no visible knot. And we will just cut the thread. Now we will start suturing the subcutaneous tissue. And we will take a buried stitch and intermittent sutures. So this is your buried knot or inverting knot. You can see how the tissues have come in closely. Again, we need to make sure that the two ends are on the same side while taking a buried suture, or else your thread will get locked and you will not be able to pull. We will continue suturing the subcutaneous layer along the entire length of the wound. can see how well the fat layer or the subcutaneous layer has been approximated. Now to end our suturing procedure, we will take a few simple sutures on the skin. Again, over here, we are just suturing the skin layer. We will just leave adequate length of the suture thread that is needed to hold and remove the sutures in the future. Make sure your edges are not getting inverted and should rather be everted. If they are getting inverted, they will not heal properly. Make sure you're not pulling the shorter end and instead just pull the long end of the suture. So this is how the final wound should look like after suturing and closure of the wound. All the edges are everted and approximated properly. You need to make sure that the edges are everted properly. At many instances, you might get a dog ear where your one end is pouting and long compared to the other end. If you encounter a dog ear, you can just give it a small cut and extend your wound in the desired direction, and the excess skin, it can be cut and extend your sutures. This is how the wound will finally look, with all the edges properly approximated and all the suture knots in one single line away from the midline.